Hey there, and welcome. Today, we're going to talk about a really important topic, one that can feel pretty stressful: emergency contraception. If you're here, you're probably looking for some clear, straightforward answers, and that is exactly what we're here to give you. Here at MediByte, our whole goal is to cut through all the noise and confusion you might find online. We're here to give you reliable, fact-based health info that you can actually use. So, if you're watching this, you might be in a tough spot. Maybe feeling a little anxious after having unprotected sex or realizing your usual method of birth control failed. It's okay. Just take a deep breath. We are going to walk through everything you need to know, one step at a time. So here's our game plan for today. We'll start with what emergency contraception, or EC, actually is. Then we'll cover when you might need it, what your different options are, how well they work compared to each other, and finally, some really important things to keep in mind. All right, first things first, what exactly is emergency contraception? Well, the most important way to think about it is as a backup plan. It's safe, it's effective, but it's not meant to be your regular go-to method. To put it simply, EC is any method used to prevent pregnancy after unprotected sex has already happened. It's basically a second chance to prevent an unintended pregnancy. But again, it's definitely not a substitute for an ongoing regular birth control plan. Okay, so that's what it is. But when is it really needed? And why is everyone always talking about urgency? Let's look at why acting fast is so incredibly critical. You know, on any given day, a single act of unprotected sex carries about a 5% risk of pregnancy. But, and this is a big but, that number is just an average. The real risk can change dramatically depending on where you are in your monthly cycle. For example, if it happens right around ovulation, that's your most fertile time, that risk can just skyrocket. We're talking up to 20 or even 30%. That's when a pregnancy is most likely to happen. And that brings us to the single most important message of this entire explainer. I really want this to sink in. No matter which method you end up choosing, it is always, always most effective the sooner you use it. When it comes to EC, time is truly everything. So what are your options? Well, they really fall into two main categories. There are intrauterine devices, better known as IUDs, and then there are oral pills, which you've probably heard called morning after pills. And these two types work in completely different ways. IUDs are tiny, T-shaped devices that a healthcare provider places inside your uterus. The copper IUD works by creating an environment that sperm just can't survive in, and it also prevents a fertilized egg from implanting. The pills, on the other hand, are all about hormones. Their main job is to delay or stop ovulation, so an egg never gets released in the first place. The good news is you have a window of time to act. Most EC methods can be used for up to 5 days after unprotected sex. That includes both types of IUDs and one of the pills, ulipristal. But here's a really important detail. The most common over-the-counter pill, levonorgestrel, works best within the first 3 days. After day 3, its effectiveness drops off a lot. Now, all of these methods will lower your chance of getting pregnant, but they are definitely not all created equal. Let's dig into the numbers and see just how effective each one really is. And wow, the numbers are pretty striking. If you get a copper IUD, the chance of pregnancy is less than 1%. It's just 0.1%. With the ulipristal pill, it's around 1.5%. And with the levonorgestrel pill, it's somewhere between 2 and 3%. As you can see, that's a really significant difference in effectiveness. So the main takeaway here is pretty undeniable. The copper IUD is by far the most effective form of emergency contraception out there. And you know, there's a huge bonus. Once it's in, it can be left in place to work as a highly effective long-term birth control method for up to 10 years. It really does solve the immediate problem and a long-term one all at the same time. Okay, so we've gone over the options and how well they work. Let's get into the nitty-gritty practical details, like how you actually get them and some other things you'll want to think about. How you access EC depends on the type. In the US, levonorgestrel pills are available right over the counter. That means you can just walk into a pharmacy and buy them off the shelf, no prescription needed, no matter how old you are. But that more effective pill, ulipristal, does require a prescription from a doctor. And for an IUD, well, that requires a visit with a healthcare provider to have it inserted. A few other really key things to consider. First, body weight. For some people, the oral EC pills can be less effective at higher body weights. That's not an issue with the copper IUD, though. Its effectiveness isn't affected by weight at all. Second, if you take the ulipristal pill, you'll need to wait a few days before you start or restart any other hormonal contraception. And finally, just a heads up, a pretty common side effect of the pills can be nausea or even vomiting. So, what do you do after you've used EC? It's pretty simple. Just follow these 3 steps. First, keep using a backup method, like condoms, until you get your next period. Second, to be absolutely sure it worked, take a pregnancy test about 2 to 3 weeks later. And third, if your period is more than a week late, or if you just have any concerns at all, make sure to follow up with a healthcare provider. We have covered a lot of ground here, so if you only take away one single thing from our time together, what should it be? It's this: the sooner you act, the more effective it will be. Please don't delay. Reach out to a pharmacist or a healthcare provider as soon as you can. They will help you figure out which of these safe and effective options is the absolute best one for you and your situation. And that's our explainer on emergency contraception. We really hope this has given you some clarity and maybe a little peace of mind. Thank you so much for taking the time to learn with us today. If you found this information helpful, please share it. You really never know who might need to hear this. And don't forget to subscribe to MediByte for more of these straightforward health explainers. Stay informed, and we will see you next time.